My guest today is Dr. Samantha Berguglio. Dr. Berguglio is a licensed naturopathic medical doctor and the founder of Walk the Natural Path Hormone Health and Fertility Care. She has a passion for helping women achieve their wellness and/or fertility goals, and she treats and teaches her patients from a mindset of natural healing that treats the root cause of their symptoms. Welcome to the podcast, Dr. Briguglio, right? Briguglio is how you pronounce it.
Yes, you
Or
did that
Sammy,
nicely.
right?
Or Dr.
Awesome.
B, it's easier.
Dr. B, awesome. So, first of all, I love your Instagram. I'm going to say that. You guys got to check out her Instagram. It's going to be in the episode notes. I kind of want to lead with that because she has a fabulous content, really rich with information and tips for fertility care and health. And before we get started, I would love for you to introduce yourself and also share how you got so passionate in specifically fertility health.
Yeah, well, thank you so much. It's really fun to have a platform like Instagram to share all this stuff with and help educate people. But hi, I'm Dr. B Berguglio, Samantha Berguglio. I actually just got married, so legally my name, I just changed my name.
Congratulations.
Thank you so much. It's been really, really fun. But I am keeping Dr. B for business purposes. So you can always remind me, remember that I'm Dr. B, so you don't have to worry about any changes. But how I got infertility, I feel like it's kind of a long story, but I'll try to keep it as short as possible um, because it also has to do with how I got into, natural medicine, which actually stemmed from when I was a child. I was pretty sick as a kid, and long story short, my mom really fought for me and found natural medicine. And I went from being on like oxygen treatments like 2 to 3 times
Oh,
a
wow.
day. Yeah, it was pretty crazy to being a total normal kid who played a bunch of sports and just loved running around and just basically natural medicine changed the trajectory of my life. And so I became super passionate about it. Went to college, was kind of like, I don't want to go to med school. That looks really hard. Kept trying to find other avenues, but I always got brought back to natural medicine. I was like, this is just where I'm supposed to be. Actually wanted to go into pediatrics originally and ended up not doing that because I wasn't able to get enough training, like hands on, like one on one with kiddos. And I just felt like that was really irresponsible to like all of a sudden start a practice where I was working with kids and I didn't feel like ready or trained enough to do that. And in my last year of school, I actually found a fertility like course. It was like an extra like I don't know, $600 on top of all the other loans I was taking out. So I was like, ooh, this looks fun and interesting. I fell in love. Like I just fell in love.
Wow.
I actually, the person who wrote the course is Dr. Jacqueline Chassie at the time. She changed her last name. I guess it's a few years now. Siementon, I think it is. If anyone wants to find her, her courses are great. But Hello Fertility is her Instagram actually. But
Mhm.
she is an amazing teacher, and I went on to join her year long mentorship in fertility after I graduated, which obviously kind of like changed the course of my life and career. And I just fell so in love with it. Um, I was actually really good at it, right? Like sometimes like you're just good at something or not. And I was like, I don't want to be a jack of all trades anymore. And I just felt like my like intuition just went very hand in hand with the fertility practices, treatment, and just, diving into that and learning more. I loved it. I enjoyed it. And then later on, I'm talking to my mother and my grandmother, and I'm like telling them how I'm so drawn to this. And I find out like my mom went through her own journey with like miscarriages and loss. And then my grandmother took her 10 years to conceive. I'm like, no wonder I'm drawn to this. Like, I'm supposed
Wow.
to help like all these people. My family had this struggle. So like now I get to help and give back. So kind of a long
It's
story. I try to give like
incredible.
most important pieces, but there it is.
Amazing. No, it's interesting because my mom had secondary infertility with me and for tried for a while. And so she had a really hard time and she also thought she was going to lose me at different times, like lost a ton of weight. So it's kind of interesting that you say that, and it's pretty wild because it does kind of hit home. And I don't know, I do believe that subconsciously we can almost feel something in our cells. There's just certain things that call to us and we just feel like, this is it. This is what we're supposed to do. And I totally understand what you're saying. Like, it really, really resonates with me. So
Yeah,
that's
right? Like, you
cool.
just keep
Well,
getting pushed down a path where eventually you're like, "Okay, I'm surrendering. This is what I'm supposed to do." Like, that's basically what happened to me.
amazing. Well, you're so good at it and I can feel the passion. I really can. Like, that's one of the things that I love Instagram. I have to say, I mean, with social media, it's like a blessing and a curse, right? But like there's so many amazing things about social media because you're able to connect with people in a different way and get to know people. And people are able to share stories and information. You can get tons of information on Instagram, especially it's really big in the fertility world. So I feel like there's just so much content, but you can really feel a person's passion and also like just drive to learn and provide quality information. And I find that with your account, it's actually one of my favorite accounts, I'll be honest, because it teaches me, and this is where I love it. I'm like, when I feel like I'm getting, as a practitioner, I'm learning so much. I'm like, I got to have them on the podcast. I got to pick their brain
You're
for my
so
guests and for me.
Thank you. I feel like no one's ever told me I run short on passion, that's for sure.
Well, it works for you and it works amazing. And so we were talking actually in the pre-talk about certain things that we feel really passionate about. And as practitioner, I find, and I know that you agree because we talked about it, that usually your passion, it's like the P, right? The P, because P for passion and P for pissed off. It's a very fine line between the two because the things that we're passionate about, we've also been pissed off about.
Yeah.
Meaning, like, for me, it's like I'm being told that you can't do something. I've always had that even in my life. I'm like, no, screw you. I can do it. Like, don't tell me I can't. And I feel that passion with my patients. When
Mhm.
people tell them they can't, and then I see that they can, and I'm like, why are you telling them they cannot do it? Like, I don't like that. It like pisses me off, but I feel very passionate about like empowering. So like you feel like that too. We talked about a couple of things. So I'll let you have the mic.
Yeah. Yeah, we talked about two main things, right? I think the first one was the unexplained infertility. That diagnosis drives me nuts because I probably said a couple bold things about it on Instagram before, and one of them that I felt like it was lazy medicine. And I feel like that seems harsh, but it's kind of the reality of it, right? Because I'm like, you're being lazy. You're not doing any more tests. You're not trying to figure out like what could be this underlying cause. You're just saying like, oh, the things that are obvious are all good. So we don't know. It's unexplained. And so that drives
It
me
feels
nuts.
like you're putting it back on the patient. That's what it feels like. It feels like, oh, well, we don't know. So here you go.
Yeah, 100%. And then, leading into the other thing that we kind of talked about is that then it's like, okay, well, we don't know. So IVF is your only answer. That drives me nuts. I think IVF is amazing. I think it has a time and a place. I think it has helped a lot of families, especially with, certain diagnoses, especially anatomical ones. But like to be like, you have unexplained, let's do IVF, or, we haven't even pulled your progesterone yet, but we don't know what else is wrong. So like, let's just go to IVF. Like it just, yeah, talk about getting heated and passionate. That just drives me insane because I feel like it's unfair and you're not doing your duty to your patients, and it's at the end of the day kind of lazy. Yeah.
Yeah, and I'll tell you, I feel like there's this common misconception. I feel like that I almost want to say it's due to marketing because we have been conditioned to believe that if we pay an arm and a leg for something, it's a guarantee that we're going
Yeah.
to get the best of the best. And I think that that's what it is. People think that it's a guarantee to go through the IVF process. And I've actually found, and again, same as you, I completely agree that IVF's incredible. Like it's
Mhm.
an amazing thing to have. It's amazing, the technology is beyond. Like I remember going and doing acupuncture for a transfer, and every time I go, I'm like beside myself on the incredible opportunity that so many couples have. So 100% yes, like for that. However, in some cases, I've actually found that my patients have had many failed IVF retrievals and transfers. And then they went on and did better getting pregnant naturally at an older age in their 40s. So, like, that kind of, it challenges that whole idea or mindset that it's a guarantee and it's like the only option for some people. So I'd love
Oh
to
yeah,
get your
I've
thoughts on
had
that.
many patients that have tried multiple IVF things, like 3 to 4 even, and come back and get pregnant naturally. IUI, same thing. A lot of IUIs, and then they'll get pregnant naturally. And they're like, I don't really get it. And I'm like, well, it's because we had to treat the root cause. Like, one of them that really stands out in my mind is that they had actually gut health issues, and everyone was like, their hormones looked actually pretty decent. Even their egg quality wasn't bad, but their gut was like not okay. Like, not
Hmm.
okay at all. Um, like diarrhea episodes daily, which is
Oh,
that's
wow.
that's not a healthy gut. And I was like, oh my gosh, what? And so we treated for a little bit, and they started to heal and they started to feel better. And then all of a sudden, like a couple months later, like boom, pregnant and healthy pregnancy. And I just I'm like, it's just a testament to like the reproductive system can be fine, but if something like your thyroid or your gut or another piece of your other systems that we have that make our whole body right is impacted, that can cause issues. Your body sometimes doesn't want to carry another life if everything isn't okay.
Yeah, totally. And so you mentioned actually a really important one, gut health. Western medicine's amazing in what they're amazing. Everybody has their own toolbox and like things or specialties. And so that's not something that's typically looked at or like, tested.
Mhm.
They'll look at like ultrasound, they'll look at like the tubes, they'll look at like the anatomical, they'll do the blood work, the hormones. And obviously, when they come to you, it's a whole other detail of testing. So let's talk about some of the things that are often missed in conventional medicine that you look at that they may not know about.
Yeah, I'll definitely talk to that. I do also want to say, like, some things are also best in combination. So I love natural medicine and I think it can do amazing things, but a lot of times also like a combination of like conventional and natural is also really amazing. I've won, like, for example, endometriosis patient that it's been really beneficial for them to have both, right? They had like the laparoscopic surgery done, and now we're working on
Right.
inflammation and reducing all these other things, but they're feeling so much better. So like I said, I can get heated about some things, but I also am very like appreciative of all forms of medicine. It's
Yeah.
just like we just have to stay in our lane, and also like know that it's okay if someone's taking from all different types. Like, if anything, that's good, right?
Yes. I always say like a team, a well rounded team with all their different strengths.
Exactly, exactly. So I just wanted to say that too. But when it comes to things that I look at that are going to be different, I mean, whew, I feel like the list can be kind of long actually. I mean, I ask from everything like what are your bowel habits or your bowel movements to your what's your gum health like? Like, do your gums bleed a lot? To, do you have headaches, musculoskeletal pain? We focus a ton on stress, and it's not like the type where it's like, oh, you're stressed, like just don't stress, right? No, we like figure out like root cause of that stress. And if that root cause needs to be explored more, it's like, okay, do we bring another person onto this team? Obviously, we focus on a ton of diet and lifestyle habits. I just ask about them. And then we talk about
Yeah.
what we need to improve versus what we don't need to improve. Thyroid health, like I said, the list can kind of go on, but it can be from anywhere from like your daily habits to environmental exposure, at job, at the workplace. I actually see a lot of blue collar men. I find that to be very common, either blue collar or very like high stress jobs, are a lot of men that I see for like sperm count and quality. And like I said, I feel like the list could go on and on. There's always kind of
Yeah.
something. And I kind of say there's like the most obvious things, which to me are like diet and lifestyle, gut health, like thyroid health. And then there's like the small things like anti-sperm antibodies and, like an immune flare or, skin conditions or, maybe some of the things that seem a little less obvious, like reproductive microbiome. Uh, and there's kind of almost tests for all of this now. It's just also it can
Hmm.
get really expensive. So like I said, I like to start with like the really big glaring things, make sure those are good before I move on to the smaller things.
Yeah, I mean, there's so many things that I definitely want to talk about with what you just said. Like, one of the things, it's interesting how people say, oh, just stop being stressed. Sometimes you're stressed because your body's stressed. Like,
Mhm.
if your body or your gut's off, it's going to impact your mind. Well, in Chinese medicine, we learn about how everything's so interconnected. So,
Yeah,
like, how your body feels, if your body's not getting the nutrients it needs, it's going to feel stressed. I mean, have you ever felt hangry? You know that, like, impacts immediately. Or if you're not getting enough sleep, if you're not getting good sleep, that's going to impact your stress levels. So it's so intricately connected. And when you have that calm, or even your gut health is better, your mind starts to feel better as well.
yeah, I love that analogy of have you ever felt hangry? I think that's so perfect. I haven't heard it, but that's so good. Like, yeah, like sometimes if
It's
you're
like a
not,
perfect example, right?
yeah, like you don't even know. Sometimes you're not even not feeling good, but it could be manifesting as an emotional response or something. I know I was feeling a little extra stressed out, and I myself did a gut health test on myself, and I was like, "Whoa!" Like honestly, would expect more physical symptoms, but I think mine were manifesting a little bit different. And I'm like, "Wow."
Right. Well, that is such a good point that you bring up, because I think that, like, for example, my patients who are sensitive to gluten, they end up feeling really well after removing gluten, but not for the reasons they think.
Yeah,
Like, they say, if I eat bread, I'm fine. I don't feel bloated or anything like that. But with food sensitivities, it doesn't necessarily have to show up as digestive discomfort. And I
100%.
think that that's like, so that's like one example of how things can impact you. You don't even realize that you could have something and that has nothing to, like, you're not going to feel it directly as that. It could show up as headaches or low energy. It could be so many things.
Yeah, brain fog, anxiety, joint pain. Joint pain's a big one that everyone just brushes off as like musculoskeletal
Right.
issue. And I'm like, no, that's like an inflammation issue, right? Like, why are
Oh,
you
yeah.
like, so yeah, no,
Yeah,
I
for sure.
for sure.
So how do you figure out, like, where you start with the testing? Like, when you first see people, I mean, I'm sure it has to do with a lot of what they'll tell you.
Yeah, so, initially, depending if I have like a single visit or I see a fertility for two. So I see, people individually, but I see the couple together, which also I think is super important. I feel like
Yeah, it
one person
is.
always seems to get ignored. Like there's never like let's treat both. It's like, oh, there's a abnormal semen analysis. Let's treat the guy and then like the female side's forgotten. Or oh, this person has endometriosis. Let's make sure we focus on that and then the man side's forgotten. So it's like I really like the fact that it's fertility for two. Honestly, it's mostly for affordability that I do the fertility for one, just because if we can try to do something. But always think treating both is the best. But when it goes, sorry, back to your question. So when I see people, it's either 60 or 90-minute visit, depending on if it's one or two. And we ask, I ask a lot of questions. First, I just kind of give them the floor. I'm like, share your story with me. Like, tell me, right? I think intuition's so important. And a lot of times, like, couples end up telling me what I need to hear in that first part because they don't even know it's like this most important thing. But I'm like, whoa, like, that was huge. Like, okay, writing that
Yeah.
down. Then I ask a lot of questions that like will branch off of what they share with me, and then we dive into family history, their own history, general review of systems, which basically means checking in with every from like head to toe, every single system of the body, and we have them answer questions like. Are you bloated? Yes or no, right? On the female side of things, definitely diving into the menstrual cycle, like a full dive in. Usually it takes us like sometimes 15 to 20 minutes just to talk about the cycle,
Yeah.
which probably seems like a lot, but like, no, I ask a lot. I ask like questions from like what size are your clots to how many tampons do you fill to tell me about all of your symptoms and like the timeline that you have them within your cycle. So we really take a deep dive into that. Um, and then, from there, I kind of compile like all of their symptoms, come up with the ideas for the labs that I want to draw. And then based off symptoms and labs, we form a treatment plan based off all of that.
Are there some common labs that you usually, like, almost for everybody use, like, or one test that you typically feel like everybody should take? I know it's
Yeah,
kind of like a one size fits all, but
no, for sure. Right. Yeah. Like I know what you're trying to say. You're like, I know it's individualized, but what are labs that are
yes.
common for everyone? Yeah.
Exactly.
So yes, and I tell a lot of people that, right? Because I'm like, you can go get all these basic labs, but I might be asking for you to get other labs based off what you tell me. So just be prepared to go twice. So a lot of times I just have people wait to come get labs so they're not going back and forth because that takes time.
Yeah.
And I'm like the person that like I just want to do all at once. But
Yeah.
there's going to be the classic, the day 3 of your cycle, so third day of bleeding, and then 7 days after predicted ovulation labs. The day 3 ones are going to be like the estradiol, the FSH, the LH. The 7 days after ovulation would be progesterone. Usually with like the day 3 lab, I also order like a CBC, a CMP. So that's like your blood count, looking at red blood cells, white blood cells. The CMP is kind of looking at like kidney, liver, and then like lipid panel, looking at like cholesterol. So just like those basics are always really nice. I used to wait to order insulin, but now I'm just starting to do it more for everyone just because there's
Mm-hmm.
just been like, it's really hard to guesstimate who's going to be have an elevated insulin because I've ordered it on some people that I'm like, I just feel like I need to order it. And then it comes back
Mm-hmm.
super high. I'm like, okay, they are not a typical candidate for insulin. But like I
Right.
ordered it and they have like an insulin of 24, which is like way over my range of what I like to see it in, right? So I kind of started doing that one a lot. Obviously a thyroid, focusing on like the TSH, free T4, free T3, thyroid antibodies. And then another one I actually also really like, vitamin D, because that can be,
Yes.
in relation to like miscarriage and loss. So just making sure that's elevated in general. I do an AMH if they haven't gotten one done. Um, that one, obviously, I wouldn't get for guys too, but so far, all the other ones that I've listed can also be for men. And then another one that I think I would do for a lot of people would also be ferritin. So ferritin
Mm-hmm.
is a lot lower in a lot of people now. It's the storage
Mm-hmm.
form of iron. It's something that the more research I've done, the more I'm seeing that they always talk about iron being too low and can cause like a bunch of issues in pregnancy and then also to try to conceive. But people forget that ferritin is a storage form, and if it's lower, usually that means that we are actually low. We're giving all our storage to like the active form, and so we want to make sure that's elevated enough. And
Mm-hmm.
there's a lot that can go into that, but that's been another one that I've been doing a lot of research on lately, and most people it comes back super low. So it's just
Oh,
kind of one of those
interesting.
things where I just started doing it. I used
It's
to
actually
only do
something
it.
that a lot of people ignore. They like totally
Yeah, they
overlook.
ignore all the time, and it's something that I would only do for those who had like a heavy menstrual cycle or history of endometriosis or like a gut health issue where they had problems with absorption. But now I'm just like starting to do it more often for everyone because
Mm-hmm.
again, it's like a lot of people are having it super low. So I'm like, okay. And with ferritin, though, then you have to go into. Sorry, I'm like totally like going on a rant here, but
Oh no, I do the same thing. That's how I
I'm like I
always
have to
think.
finish it
It's
out,
like go
right?
everywhere. Yeah.
Yeah. Well, but I'm like with ferritin, it's nice too because first you can treat it with like iron and like vitamin C, right? Like see if that's the culprit, and then you test, and if it's gone up, usually that is the issue. But it can also be due to like low ferritin can be due to chronic inflammation or an
Mm-hmm.
underlying like disease or like virus or bacteria in your system that you need to
Mm-hmm.
figure out to um, treat. And so sometimes I'll just do the iron first, and then we can go to the other piece if it's not working, because that means that there's definitely something else going on.
Yeah, I mean, interesting. Talking about iron, what I find interesting about it, and I remember like listening to a podcast and they talked about how it's better to have things like beef liver or like through foods because
Mhm.
it has a well-rounded combination of nutrients that helps iron absorb better
Yeah.
versus when you're just taking iron and sometimes the body doesn't know what to do with it and it just kind of it almost gets toxic, the
Yes,
amount
yes,
of
it
iron, because it's
totally
not.
can.
Yeah, so let's talk about that because I think it's really important to talk about because people might be like, oh, if that's what it is, let me just take iron. But like, that's not always the solution.
No, you're totally right. I mean, obviously, like a beef liver on eating more meat, cooking with a cast iron pan. There's the good old
Right.
fashioned
Yeah.
iron fish. Like, there's so many different things you can do. Some people, usually, I give iron to people who have a hard time incorporating like meat or have a hard time cooking. Like, it's very individualized, right? Like, you kind of have to
Yeah.
meet the patient where they're at. But things that I will recommend for iron, and just clarification, this is not medical advice. This is just things I like to do in my
Yeah.
practice.
Yeah.
um, but I like to do, actually, there's a lot of studies on dosing iron every other day actually is helpful for absorption. Pairing it with vitamin C. So that either means like eating an orange or getting a supplement that has vitamin C in it, or taking vitamin C with the iron. That's going to, and those things make a big difference, right? So they sound little. A lot of people worry about constipation with iron, and that's where like they're like, oh, that can be an issue too. So if you just eat it, it'll be better. Eating it's always going to be better. I'll never take away from that, but just because we're also on the side of supplementation, there's different forms of iron. And I like an iron bisglycinate form that's actually
Mhm.
absorbed a little bit easier and usually doesn't cause constipation. I say usually because I
Mhm.
have seen it cause constipation one time. I was shocked, but it
Okay.
did. And
Yeah.
so that's where I'm like, let's just really focus on like cooking with the cast iron and the iron fish and like let's eat meat, right? Like let's try. I mean, the
Yeah.
leafy greens, people talk about that all the time. They can be helpful, but they're not digested. They're
It's
not in
not
our
the
body.
same.
Right? Yeah, it's not the same.
And then on the other hand, too, like, I mean, I have like one patient that her doctor said, stay away from eggs, stay away from red meat because your cholesterol is high. So I wanted to talk to you about that because I know that there's like this school of thought that just avoid all the things that have cholesterol and you'll be good. Or why is the cholesterol in there in the first place? Could it be covering up an underlying inflammation? Because in Ayurvedic medicine, they talk about like, Vata Pitta Kapha. I don't know if you're familiar with like
Oh
the different
yeah. Oh
elements. Yeah,
yeah.
yeah. So like when something gets really inflamed, they say kapha, which is a little bit more of that like moist, heavy substance comes over to protect. So like the same thing with like amyloid with Alzheimer's, possibly like is it because does it come in to protect something? It's like this coating. Same thing with like what we just cholesterol. So does that come in to coat the walls because there's inflammation?
So I feel like I have to answer a couple other things before I answer that question. One of the things is
Yeah.
I don't think cholesterol is the villain that it used to be. So there's a lot of studies that say like more cholesterol is better than not enough cholesterol. And
Mm.
cholesterol is needed to build, it's a building block for our hormones and things like that. Cholesterol is needed. Like people villainize it so much, but like even like the bad versus the good, right? The HDL is the good, the LDL is the bad. But we still need LDL cholesterol, right? Like these things our body needs. One of the theories, and it's a more recent one, but it's still a few years old now, is that it's not actually the amount of cholesterol that's an issue. It's more related to like if there is inflammation or not. So if you're saying, on one end, you're like, is the cholesterol being there as like a protective thing for inflammation, or is cholesterol being that elevated not as terrible as we think it is, but we need to make sure that like the inflammation is monitored and reduced. That's always like a big question. And then another one is like looking at ratios. Like cholesterol ratios are actually the most important thing, right? So, okay, we could have elevated, LDL or total cholesterol and triglycerides. But what if we have like an HDL that's like in the 80s or 85 or something? That's, to me, if we have a cholesterol that's even like, you know, it seems to be extremely over the limit.
Hmm.
But we have this really strong HDL, like maybe it's not as big of an issue as we think it is, right? Also, a lot of times, instead of eating things that have less cholesterol, I usually just encourage eating more fiber. So,
Hmm.
fiber actually binds with cholesterol and then we just poop it out. So, like,
Hmm.
instead of like limiting all these things, I'm like, maybe you're just not eating enough fiber. Maybe it's the other thing. Maybe it's not that you're eating too much of something. Maybe it's maybe it could be either a combo or maybe it's you're not eating enough fiber, which most people don't, right? Because fiber is in like
Hmm.
the veggies and things like that. So
Right.
it's like maybe we just need to eat more fiber, nourish the liver a little bit more, and then our cholesterol issue goes away.
Right.
Um, so sometimes it's kind of a combo. Sometimes, yes, it might be accompanied by the inflammation. Maybe is it the chicken or the egg, right? Is it the inflammation that's
Right.
causing cholesterol, or is it cholesterol that's causing more inflammation? At the end of the day, I feel like we truly don't know that answer 100% yet because it's different studies that keep coming out on it. But overall, I would say my biggest thing and my biggest recommendations to treating cholesterol are actually by nourishing the liver and eating enough fiber.
Yeah.
Obviously, if they have a really bad, high fatty diet with like really bad fats, like unsaturated fats, then that's an or saturated fats.
Saturated fats. Yeah.
I'm like, wait a minute. What I said was wrong.
You know what it is? We talk too much about this all the time. And it's just our
Yeah,
brain's like, huh?
like totally. My brain was like, whoopsies. At least I caught it quickly. Whew.
You did.
Basically, we do want to limit that, right? But like eliminating the good fats, like avocado and eggs and stuff, like that's not what we want to do.
Yeah.
That was a big rant, but there we go.
No, I mean, I will say, like, when people say I can't have eggs, I can't have the yellow of eggs, it's such a great food. So, but then of course, I'm always afraid to say, don't do what your doctor said. Like, I will never say that. It's
Right.
just, you know,
Mhm.
so I wanted to get your opinion on it because you hear just so many different opinions on
Yeah.
everything that it gets very confusing. And then sometimes the mainstream opinion isn't updated.
Right.
I'm
No, they say
finding
it
that, like,
takes
yeah.
10 years in medicine from an article coming out to making actual changes. And then by the time that happens, there's a new article that comes out.
Yes. Then, of course, you don't want to, again, step on other people's toes. And you're like, well, I kind of remember hearing a study that says the opposite of this, and I'm not talking about this specifically. I'm just saying in general. So
Yeah.
sometimes you just get so many different perspectives. But then, of course, as a practitioner, you have to be very careful as to what you're suggesting. And you don't want to go cross basically somebody's other treatment plan with their
Yeah.
practitioner, that kind of thing. So I'm sure you know exactly what I'm talking about.
Totally. Yeah. And I also just give patients options. I'm like, we can try this and let's monitor. Let's like do
Yes.
this way for a couple months and then get your labs drawn and then do this way for a couple months and get your labs. Like we can, if their cholesterol isn't like in scary high levels, then I'm like,
Hmm.
it's like we have room here. There's room. I'm like,
Yeah.
how long do you think your cholesterol's been like this? Like, we don't have to like change things tomorrow. Like we can just start slowly working on it. Like I said, if it's not in a dangerous place, but usually it's not. um,
Yeah.
and so I think the fiber thing is honestly the most underrated thing there is. And
That's a
then
good point. Yeah.
yeah, and then eliminating the bad fats versus and keeping the good fats because the good fats are what keep your HDL high and they're helpful for that really good ratio. So we don't want to eliminate the good stuff. We want to eliminate the bad stuff.
Right. So the good stuff, meaning avocados, salmon,
Eggs,
good.
nuts, you
Yeah.
know. Yeah,
Yeah.
exactly.
Very important information. So foods, I think that's a huge thing because a lot of, we just don't, we're not conditioned to eat healthy. I just feel like there's this quick fix and a lot of processed foods, and people don't have the time or the energy to cook. But that's one thing that I've at least seen that has been a little bit more difficult is really implementing a new way of living because it's so intricately connected to our behavior,
Mm.
and it impacts inflammation, it impacts fertility, like in so many ways. And
Yeah,
then also like certain food additives that can impact gut microbiome, like thickeners.
I know. And now there's like this thing though where it's like natural and holistic medicine is like kind of trending. Like let's just
Hmm.
like call it what it is, right? Which is cool because when I first started, I would tell people what I do and they have no idea. Like no one knew what I
Yes,
was going to do.
we're becoming mainstream.
Yes, it's more mainstream, which is awesome.
Yeah.
But now it's like also been taken to the extreme. So I'm like, oh goodness, now we're like flying on this other side where it's like, oh God, like everyone's eliminating everything and like it's just been crazy. And so now people come to me and they think I'm like chill. They're like, that's it. I'm like, yeah.
Wait,
And
so tell me, what do you say, like, typically? I mean, what are your big things that people should pay attention to, and what kind of things should they be a little more lax on?
yeah, so like the thing I'm most strict about is sleep. I will
Hmm.
always be like sleep over everything. Sleep rules.
Yeah.
Sleep
Yeah.
is like you will not if you wake up early to sleep work out, your workout's not going to be as effective than it would have been if you just like slept a little bit longer and then maybe try to get like a shorter workout in, right? Like it's things like that. I will always stand by sleep first. Always, always. Second, honestly, diet and movement they're kind of linked for me now. It always used to be diet first, then movement, but now there's just so many like there's so many people going through a lot of like stress and like mental health struggles that yes, diet can help with, but I feel like movement just helps set the tone for so many people's day where it like allows them if they move, it like allows them to like follow up with more healthy habits. So it's like this weird,
Hmm. Oh
you know
yeah,
what
it's
you know what I'm
somatic. I
saying?
mean, because we were talking about how like your emotions are very much tied to your body. That's why somatic therapy is so powerful.
Mhm.
Probably like another step over talk therapy because and which is why things like yoga really impact the mind because when you're moving, you're sort of processing emotions and emotional states
Yeah.
in a different way. And it also helps you cognitively. I mean, there's just so movement's like very underrated.
Yeah, well, and because they only people, I feel like we're only looking at it from like a what does movement do to your body versus what diet does for do to your body, right? And but we're forgetting like the oh, if I move and I feel good and I'm happier throughout the day, I'm more likely to like pick the healthier choices and eat the healthier
True.
foods than and get restful sleep and all these other things. So honestly, they're kind of tied for me. Sometimes movement ranges up. I don't know,
Yeah.
it
But
ebbs
I
and
but I'll also say if you're getting good sleep, you're going to be less likely to grab that sugary
yes.
snack.
Exactly. So
Yeah.
this is where it's kind of like all of it matters a lot, but that's why sleep is like number one for me.
Yeah.
Um, but sleep, so like obviously the diet and the movement piece. But when it comes to diet, I feel like a lot of people are really strict now. There are so many bad foods, yes. There are so many seed oils and all of that. But I feel like now people are going on the other side of getting really stressed out about what they're eating, how much they're eating,
Mhm.
making sure they're getting all their nutrients in. Now I'm like, oh God, we've like overcorrected for a lot of people now that are in this wellness space. I'm like, okay, we need to like chill out a little bit. Like, not everyone needs to eliminate gluten and dairy. If it bothers you, eliminate it. If you have an issue with it, eliminate it. If you're allergic to it, eliminate it. But like, if you eat it and you feel fine, like, let's just not cut out another food, right?
Mhm.
Um, you know, a lot of practitioners believe that like no one should eat that and dairy is super inflammatory. And I'm like, well, yeah, but like quality matters always. So if you're getting a good
It's true.
organic dairy,
Yeah.
that would be helpful for some
Same thing
people.
with organic weed because it's not sprayed with glyphosate. I think that that's a big thing too. I mean, I'll be honest. I mean, it's just the world we're living in right now. It's a little bit of an uphill battle, but I agree with you that it can almost manifest. And I've talked about this before. It can almost manifest very similar to an eating disorder.
Yes.
And I mean, because like people get so upset and it really impacts them how they're eating. So it's a fine line
Mhm.
of having a balanced perspective on food.
Yeah, yeah, it's orthorexia. It's literally actually has a technical name now, and that means
Hmm.
you're so stressed about eating healthy, you either like just won't eat at all, which is actually not good for women. They'll say like for men, it's actually better to fast than eat the unhealthy thing, but for a lot of women, it's better to like actually eat the unhealthy thing than to fast for too long. Fasting's still okay,
Yes.
but that's a whole nother conversation. But
Yes.
um, yeah, so I go from the approach of 80-20 rule and making it sustainable. So I'll tell my patients like all the time, I'm like, you're not a perfect person. You can't be perfect all the time. And if you're going to stress about being perfect all the time, that's a whole nother thing we have to deal with. So instead, let's give you freedom to live your life. I go out and eat French fries like all the time. I love French fries. Like, I
Me too.
guarantee those are not always
It's
fried
good.
in like olive
Yeah.
oil or whatever. They're definitely fried in probably like a seed oil or canola oil. Like, I know that,
Hmm.
but I
Yeah.
love them. But the rest of the time, I get my movement in. I'm drinking tons of water. I'm sleeping like nightly. Like, I take care of my mental and emotional health. Like, I'm doing all these
Hmm.
other things that so when I eat the French fries, it's not that big of a deal.
Right. I get
And
no, I
like,
get what you're saying.
yeah, and so that's where I want people to feel free now. Um, they can be as careful as they want as long as it doesn't cause like chronic stress. Like, if avoiding all of that stuff actually helps you and relieves stress, great. But for majority of people I've seen, it really causes a lot more stress. So I have become very picky about a couple things, and then I kind of just say, I'll help you with the other stuff, right? Like eliminating sugar. That's a big one. That one to
Hmm.
me is a bigger deal than like the dairy and the gluten, right? So for me, I'll be like, okay, let's reduce sugar, but I'll give them ways to reduce it, right? Like, how do we make our own healthy Reese's cup at home? That's
Hmm.
not going to be bad, right? Like you would have a couple Reese's cup honestly a day if you're making them out of like organic dark chocolate and like organic peanut butter that like has only the only thing is in it is peanuts, right? Like I'm not as worried about that then. And they'll be like, "Oh, okay, I'll make those. I love to cook or I love to bake." Great. I'm like, "Awesome." So like boom, like that's already helping their sugar habits, right? Talking about pairing foods, like instead of taking away, more like add in, right? Like if they really like their smoothie in the morning, that has all this stuff in it, they say smoothie's not that great and it's not good on the stomach and all of these things. I know in Chinese medicine, it's actually probably not good at all because they say you want to start with like warm, right? Like they're like, we
But you
want,
know, it's funny that you say that because I do tell people the 80-20 rule as well, but I do that with raw. So,
yeah,
like, if they love their smoothie, fine, but just make it like 20% and that's your 20%. Or
yeah.
if you're having smoothies and then a ton of salads and then all this raw stuff, fine. Then that starts to add up. But I say the same thing. Leave it out for a little bit so that it's not freezing, like frozen. Just kind of like let's do this balanced.
Mhm. Yeah, and sometimes I'll be like, make it a little bit thicker. So like let's maybe add some oats or some chia seeds or some more veggies to it to add some fiber and then like maybe eat it with a spoon instead. So that's getting those like chewing mechanisms going. We're really just starting our digestive system a little bit more than just drinking something.
Right.
Um,
That's a good
but
point.
you
You want
can
those
compromise.
enzymes.
Yeah, you can compromise and just add things in. You don't have to like completely take away everything. And I think a
Yeah.
lot of people are shocked by that, surprised by it, but they like also kind of love it because it's like, whoa, this is
It
actually
feels
doable.
good. It feels safer, first of all.
Mhm.
It doesn't feel as pressure filled. And it also is like I know from a mindset, from a subconscious mind thing, because I studied hypnotherapy. I feel like behavior and like our like what is it that stops us from changing habits? Like we all have habits and we repeat, repeat, repeat. And one of the biggest almost like laws is that you cannot create a vacuum.
Mhm.
And that's why it never works to just stop anything. So
Yep.
you have to just substitute. So I love that you said that. Like intuitively, you're almost like realizing that about the mind. If you're giving the mind a substitute or instead of this, then have that, but it's kind of similar. And then it's much easier to start a new habit that way.
Yeah, and you just have to give people kind of a chance instead of saying like do this to do that. You just like, okay, let's add or let's yeah, like you said substitute.
Hmm.
So,
I love that.
I'm also very passionate about that as you can see.
Yes, yeah. Well, I mean, these things are important for people to know because once you have this information, you have a lot more empowerment. And I feel like people just don't have that information. Everybody deserves to know that. So I love this conversation. I mean, I can keep talking to you for hours, but obviously we have like a limit on time. But I definitely love picking your brain on these things. And I think that you have a really nice balance on
Thanks.
how you look at it. Um, so for people who do want to work with you or like learn more about you, how can they find you?
Yeah, well, we kind of talked about Instagram earlier. That's a very easy way. Walk the Natural Path on Instagram. I do have a website. It's also Walk the Natural Path. So anything with that, your odds are you're gonna find me somewhere.
I love it.
So you can reach out, yeah, in DMs. Sometimes I'm a little bit slower, so sometimes I recommend filling out like a new patient form, or booking a consultation call with me so we can chat a little bit about like your case and then what I can do to help, or if I feel like we're a good fit.
So you help people virtually too. I just want to mention that, not just
Yeah.
locally.
Yep.
Awesome.
Virtually too. Yes.
Also, so what was the inspiration to walk the natural path? Because I see you actually walking many natural paths and hiking, and I think that's so cool because you do a lot of like nature walks.
Yes. Oh my gosh. Such a passion of mine. I honestly like, I used to do like one a week for sure. I need to get back to it. Since the wedding, it's been a little crazy, but Walk the Natural Path actually came from the idea of creating an Instagram to help promote natural medicine before it kind of dove into this like mainstream thing, right? And I don't know, the name just like came to me, which was actually pretty crazy because I feel like I'm not the most creative person. So for that to happen, I was like, oh, this is it. And then it just kind of took off. And then when I switched the Instagram over to my business, I think it just stuck and it was close to my heart. And my name is Dr. Samantha Berguglio, which is very, very long. And I was like, a lot of people just go by like my bestie is like Dr. Sienna Miller. I'm like, that's so cute. That's short. And that's kind of like what her business is. And she has a different title now, but I decided to go with it and it stuck. And like you said, it's part of
Awesome.
who I am. I walk nature trails all the time.
Because like I see you walking nature trails, which by the way, that's a whole other topic. But I think that doing that is also really good for our health.
Yeah, in our hearts and yes. But I guess really what it's about though is it's saying like I'm walking the natural path to like healing. Like at the end of the day,
Yeah.
it's like always walking this natural path. And natural though can mean anything to anybody, right?
Yeah.
So not to get on a whole nother convo, but just to wrap it up, it can mean the actual natural medicine that everyone really thinks about, but it's the natural path for you. So that could also be like combining conventional IVF plus natural medicine. That can be your natural path. So it's what feels natural to you. It's kind of supposed to be interpretive, but yeah.
I love it. Well, that's a great note to end with. And this was an awesome conversation. I'm so glad we finally met. I know we were like DMing each other back and forth on Instagram for a while and following each other. And then I was like, I got to get her on the podcast. I really like the stuff that she's putting out. So thank you so much for coming on here, Dr. B.
Oh, thanks for having me. This has been wonderful.
So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.